today's Focus on Your Health, Teresa Snow shows us a man who's beating the odds.
Focus on Your Health is sponsored by MU Healthcare.
The pancreas sits behind the stomach and it helps with digestion and blood sugar regulation. A Montgomery City man is adjusting to life without his pancreas after a tough battle with cancer. On rainy days, Butch Thurman has to settle for pictures as a way to visit the family farm where he grew up.
I've got 3 brothers, no sisters, and we all worked on the farm all of our life.
In fact, his walls are covered in photos of the people who've been there through the good times and the bad. Butch remembers the pain that first sent him to the doctor.
It just hit me. I mean, took my breath more or less, just pain in my stomach, terrible.
The attack of pancreatitis was actually a fortunate warning sign. Scans showed a mass, stage 2 pancreatic cancer. At University of Missouri Healthcare's Ellis Fischel Cancer Center, a team of specialists met to decide the best course of treatment.
We've got different disciplines in cancer therapy that all have effectiveness, but it's only through combining them appropriately that we really give the patient the best chance of cure.
Butch's treatment plan was surgery followed by chemotherapy. Dr. Kevin Staveley-O'Carroll performed the complex procedure to remove the pancreas. And though the 5-year survival rate for pancreatic cancer is just 9%, with surgery techniques improving and advances in chemotherapy treatments, Butch's cancer team is helping him beat the odds.
You know, this is treatable with real chances of cure.
This January will mark 4 years since Butch's operation, proving that even a bad hand can turn into a win.
Keep on going. I ain't gonna give up.
Joining me now is Dr. Kevin Staveley-O'Carroll, a surgical oncologist and director of the Ellis Fischel Cancer Center here at MU Healthcare. Butch, it seemed remarkable he was out of the hospital so quickly after surgery, and it was a complex surgery. Is that unusual?
It's quite usual now. You know, we've worked hard as teams of surgeons, anesthesiologists, and nurses to develop enhanced recovery after surgery protocols. So we work with patients so that the surgery journey goes much more smoothly. We actually brought in a project manager from NASA to help us kind of build this team. And so patients like Butch are out of the hospital, back at home much more quickly than they used to.
That is specialty training from NASA. Tell me about what a person or a physician should look for the early signs of pancreatic cancer.
It's some new information that pancreas cysts can turn into cancer. So when we discover those incidentally on a scan, we should follow those closely. And diabetes, when diabetes presents in the setting of weight loss, it should prompt an investigation for pancreas cancer, because usually an adult develops diabetes when they're gaining weight and becoming obese.
Good to know. It's a complicated issue. Thank you very much, Dr. Kevin Staveley-O'Carroll. And with Focus on Your Health, I'm Teresa Snow.
Focus on Your Health has been sponsored by MU Healthcare.